Hi, my name is Madeline Anderson, and I'm going to be doing my final presentation on labor pain in hospital and out-of-hospital births. So my presentation compares labor pain in hospital and out-of-hospital births. To start, it's important to know that labor pain is often something that is feared by pregnant women. It's a big factor in every woman's experience of delivering a baby. There are many factors that influence pain felt during labor. So how is pain of women who deliver in hospital different from pain of women who deliver out of the hospital? There are many factors influencing pain perception in hospital births. To start, it's important to realize that hospitals are primarily for sick and hurt people. They have a very specific purpose, and that is to help the sick and the hurt. And there is a place for people who deliver in hospitals, especially high-risk women. However, studies have shown that hospital interventions can have a negative impact on labor pain, and studies show that noisy environment and invasive medical care actually increase pain. What about the hospital environment increases pain? Well, loud noise has been shown to increase pain, increase blood pressure, increase heart rate, and cardiac output. Loud noise is sometimes unavoidable in a hospital setting because of the equipment, the staff, and other patients. There's also the unfamiliarity with the atmosphere of the hospital and delivery room that increases pain. And the presence of a midwife has been shown to have a calming effect on birthing women. Unfortunately, continuous labor support is sometimes difficult in a hospital, even for midwives who deliver in a hospital, because they're monitoring fetal heart rate strips, they have multiple patients laboring at once, and it's difficult to have that one-on-one care. There are many factors that influence pain perception in out-of-hospital births. Many women who choose to give birth out of the hospital do so because of increased independence. There's less rules and regulations. In general, out-of-hospital births are for low-risk women, and so they tend to be healthier, and therefore there's less regulations and rules that they have to abide by, increasing the independence and choice that women have. Studies show that alternative pain interventions can be more effective than medical analgesia. And alternative pain interventions have been shown to decrease labor time and increase women's satisfaction. So what is it about alternative pain interventions that are so effective? Well, massage has been proven to decrease back pain. The freedom of positioning has been shown to decrease pain, especially vertical positioning. A lot of hospital deliveries have the women deliver in the recumbent position on their back, which is good for doctors because they have a good view, and it's good in a case where a woman has an epidural and she can't move her legs, so it has something to support her legs. However, the freedom of positioning has been shown to decrease pain, and that's something that women are more likely to get when they deliver out of a hospital. Water immersion has also been associated with decreased pain and shorter labor times. And this study was done by the American College of Gynecology and Obstetrics. So I want to go here to the link and show the official committee opinion on this study. So if you look here, their statement says, quote, "Immersion in water during the first stage of labor may be associated with shorter labor and decreased use of spinal and epidural analgesia, and may be offered to healthy women with uncomplicated pregnancies between 37 and 41 weeks of gestation." So that's a very positive statement. They admit that water immersion is associated with shorter first stage of labor and decreased pain. However, if you go down here, they also say, quote, Facilities that plan to offer immersion during labor and delivery need to establish rigorous protocols for candidate selection, maintenance and cleaning of tubs and pools, infection control procedures, including standard precautions and personal protective equipment for healthcare personnel, monitoring of women and fetuses at appropriate intervals while immersed, and moving women from tubs if urgent maternal or fetal concerns or complications develop, unquote. So a lot of hospitals see this committee opinion and are afraid to do water immersion in hospitals because of all the rigorous protocols and requirements that ACOG sets for them in order to do water immersion. To conclude, labor pain is an important aspect of delivery for every laboring woman. It's sometimes the defining aspect of giving childbirth. Therefore, women should know their options in pain control. And by comparing factors for pain control, it allows women to make more informed and autonomous decisions. Thank you.